Well, House Speaker Paul Ryan says that he'll call the chamber back from recess if the new GOP health care plan gets enough support. And as he and House Republicans continue to tweak that measure, one former opponent says it's not exactly what he wanted, but he would be willing to compromise for the greater good. One America's John Hines caught up with Rand Paul and has this report from Capitol Hill.
Sir, I wanted to follow up with regard to health care. I know it's been very busy. I spoke with Congressman Jordan earlier and also Mr. Meadows earlier in the week, and they seem to be somewhat optimistic about some kind of a compromise, and I wanted to get your thoughts on where it stands now, sir.
What I've been hearing is that the administration has been offering them to allow governors to have a waiver to be able to remove insurance restrictions. The insurance restrictions are what we see adding cost to insurance. So if I tell you you can buy insurance, but there are 10 things the insurance has to cover, then the insurance is going to cost more. But if you're young and healthy, 22 years old, and you want to buy less expensive insurance, that's forbidden under Obamacare. We want at the very least, we want governors to be able to waive those regulations so we can have less expensive health insurance to be sold.
And do you expect that potentially what emerges may look like your health care plan?
I wish, but basically most of us, the conservatives, want a complete repeal. And that's still what I'm for. Unfortunately, the many parts of the Republican Party who used to be for complete repeal and actually voted for it 60 times when Obama was president are no longer for a complete repeal. So now we're having to negotiate among Republicans for less than complete repeal. And it's worse than that. They also want to institute new federal programs. So currently in the bill, there's like $115 billion to give to insurance companies. Now they call it reinsurance. They say, oh, when someone gets sick, we'll keep insurance premiums down by subsidizing the insurance company. But that's not sort of my way of understanding capitalism, that insurance companies get to get rich off of their profits, off the great group plans, and then when they start to lose money over here, the taxpayer is going to be the backstop for them. I don't like that at all. I think it's a terrible new federal program. They also have in it refundable tax credits that replace Obamacare subsidies. So Obamacare gave you government subsidies. Now they're going to give you subsidies. They just kind of change the name and the way you get them. But essentially, there'll be money that you get back from government that you did not pay in taxes.
Thank you, sir. And finally, do you anticipate perhaps a resolution? We have a 2-week recess. Do you think there'll be conversations, and might there be some kind of compromise in the next 2 weeks?
I'm still hopeful. When I talk to the House Freedom Caucus, they say they still want to get to yes. We all ran on repealing Obamacare. We're very much for repealing it. We just don't want to replace it with Obamacare Light. We also, when we repeal it, want to be able to tell the American public that we think their insurance rates will go down, not up. And our fear is if you keep these insurance regulations in place, that alone will keep prices doing this. And the death spiral of Obamacare might continue. None of us want our name on a vote that we vote for something that allows the death spiral of Obamacare to continue.
Thank you, sir.